Alrighty. Well, I'm going to give it a couple minutes for people who are joining, and if people are coming from a previous meeting and need a couple minutes to get in. But thank you everybody for hopping in today. We're going to be covering quite a few different things, and it's going to be really exciting. So thanks for taking the time to join today. If this is your first session with us, welcome. If you've been here before, welcome back. Um, my name is Jenna, and I am on the TDS Health team. I'm on our client engagement team. So if you have worked with us in the past, you may have seen me while you were onboarding something or maybe hosting a training for students and faculty. So it's good to see you all again. And for those who I've never seen or heard of, nice to meet you. I am joined today by my colleague and friend Andrew, who is our Senior Clinical Product Manager. I'll let him give a little brief introduction and then we'll get right into it. Andrew?
Perfect. Thank you so much, Jenna, for the kind words. So I'm Andrew Yukovich. For those that don't know me, I am the Senior Clinical Product Manager here at TDS Health. My background is in nursing education and as a clinical provider. I'm a pediatric nurse and nurse practitioner, and I've also been faculty at two nursing schools here in Rochester, New York, where I live. I've taught across didactic, clinical, lab, as well as simulation. And before I joined TDS Health, I was privileged to work for one of the industry leading healthcare VR companies. And I really appreciate all of your time today. And we hopefully will be able to give you some wonderful insight into our platform that we're really proud of.
Thanks, Andrew. And I think it's good for me to give this disclaimer out the gate as I start to navigate some of the simulation pieces and such. I am not a nurse by trade or a clinician by trade. My background is actually in medical microbiology. So if anyone is really into epidemiology and things like that, I am your buddy in this. Um, so echoing off of what Andrew just said, we're going to be focusing on one of our resources called Neural Consult today. For some of you, that may be a new name, and for some, you may have heard of them before. We'll be focusing specifically on the simulation aspects of Neural Consult as we get into that. So I want to call out right out the gate that there is a lot more to Neural Consult than the pieces that we're going to cover specifically today. And so Neural Consult from a 10,000 foot level is going to be a learning educational platform with content for a variety of different learning environments. So whether that's looking at things for didactic, clinical, simulation, there's pieces across all of those areas. So we're going to focus today specifically on the creation of simulation cases and that interface, but I do want to call out that there are some other pieces in there, whether that's utilizing some study tools to be able to generate summaries, flashcards, questions. So there's a lot of great pieces of Neural Consult that we have in there. We're going to focus specifically, though, on those AI-powered clinical learning simulations and how those can be utilized and as an asset to you all. Andrew, do you have anything else you want to echo on that?
No, so I just want to emphasize that Neural Consult really is an all-encompassing learning and AI-powered learning and simulation platform. And one of the unique characteristics of the platform is that it's institutionally secure and white labeled for each institution that utilizes it or purchases it. And it's grounded in your curriculum, your standards of care, and your clinical practice guidelines. So the generation of learning resources, study tools, and clinical case simulations can be directly developed through your lecture slides, your PDFs, your textbooks that you're licensed with. And that makes it one of the unique features of the platform as opposed to other ones that are on the market.
Awesome. And we'll dive into that a little bit more when we show some of these pieces of case creation, where those elements are, where you can take that really custom approach of utilizing material yourself, or even some of the starter content that's in there to inform and generate material for you. Talking a little bit more about the AI component, which I think, Andrew, you and I have talked about this in detail in preparation for this call, but the Neural Consult team, when we connect with them, talks about how they want to really see this as an AI empowering tool versus just utilizing AI to generate material for you. So you're giving the AI the content and it's going to help make something more efficient and effective for you, save you time versus it generating content just to generate you content. You're giving those frameworks and you're providing that security by saying, I want to use just what I have, what I've established, and the things that I deem appropriate for whether it's my students or fellow faculty to be using and seeing. So quick, I have a couple topics up in front of us, but we're going to hop right into the platform to get us started. A couple little pieces in here. So you may see either the chat, the Q&A, or both on your screen. Feel free to utilize those if you've got questions, comments, concerns, favorite color. Please feel free to utilize those. I'm going to ask Andrew to keep an eye on that while I am popping into some of the simulation pieces and also showing some of the development content that you can do. So we're going to talk about case creation and generating cases, so custom cases yourself. We're going to look at a pre-existing one that's in here that we'll go on through. And then we'll talk about some really exciting features and releases that we see coming up in terms of analytics and growing those elements to that portfolio. Um, so before I hop in, Andrew, anything else you want me to add before I get in there and get going?
No, I would just say that, as I said, we are focused on the simulation component today because, as we all know, and especially myself pulling from my background, being able to expose your students to repeatable, scalable, deliberate practice before they enter the actual clinical realm is really important. And this platform does a wonderful job of being able to not only pull from the existing repository of cases that we already have created, but putting the faculty in the driver's seat to create your own cases that are in alignment with your curriculum and your learning objectives. And as we will touch base on, yep, as we will touch base on, it also comes with a personalized analytics dashboard that will allow you to track how your students are progressing in alignment with various competency frameworks. And you can actually swap in different frameworks depending on how your institution, what framework your institution uses.
Perfect. So let's get going. I did see a couple things popping up into the questions, but I do think it might be good, Andrew, to go through maybe some of these creation pieces that I think might help address some of the questions of to how we can really tailor and how that might be different from just uploading something somewhere else. Does that work for you?
Yeah, absolutely.
Awesome.
We can answer these questions also at the end. Keep them coming. As many questions as you can think of. We encourage questions, but just at the end, it might be easier to kind of collate all the questions, and then we can take time to answer them.
Perfect. So what you're going to see on my screen right now is I'm going to be accessing the administrative portal for Neural Consult. So we are in the environment that is going to show kind of that administrative side where you can do some case creation, analytics, uploading file content. So talking about putting in your own materials, things like that. We're going to focus specifically on this case hub over here on the left-hand side. I want to really highlight these top three areas here that you're going to see of rubrics, scenarios, and cases. So these are going to be the three elements we're going to talk about most in detail right now. First one being the rubrics. Um, and Andrew, I'll probably lean on you a little bit for kind of talking about the specifics of rubrics and things like that. But this is where you're able to, whether it's utilizing the extensive list of ones that have already been created within the Neural Consult system of rubrics, you can also create your own rubric. So you'll see that we've got a variety of different ones in here with different grading points, different criteria pieces. All of those are in here. These are ones that are pre-created that we have. But you also can hit this create rubric section here, where then you can generate a rubric based on maybe something you already have. You have a pre-existing one that you already utilize, or you're developing one and you want to be able to put that in here and say, this is what I want to be graded against. This is my rubric. Now, I do not want the flat screen of all the empty boxes to make you nervous of all the things you'd have to go in and put in here, because I want to point out that we have a little box down here, this little magic wand, where you're able to put in plain text, let's say that rubric you've already generated that you have existing, throw that into here and it'll be able to generate that for you. So all that information you have, all those pieces you've built out, you can pop that into here and it will generate the rubric for you. Once that happens, you can then also go and make edits if you want to change a few things, if you want to, reorganize some of them, different places, different pieces, different point values, you can go through and do that yourself. So whether you want to do this manually by entering and adding pieces in, or if you want to use that magic wand that we have here to upload something that's pre-existing.
One thing I would emphasize is we've tried to develop existing rubrics so that faculty already have something that they can build upon if they would like to. But as Jenna mentioned, we have that customizable nature because there may be rubrics that you're already using for actual OSCEs, for let's say your graduate students, for your nurse practitioners, for mannequin-based simulation, for any simulation that you are doing to prepare a student for a clinical experience, like an actual clinical rotation. So if you already have those institution-specific rubrics, as Jenna mentioned, you can open up that wand feature, leverage the use of AI, and actually just completely upload your rubric. And then that rubric is, you can edit it however you so choose in a lot to fit these cases that you will be creating. And that rubric becomes part of the repository of rubrics that you can pull from for any cases moving forward.
Awesome. And I just opened a pre-existing one just to show you what we're talking about because I'm talking a lot about generating things and then popping up for you, but just to show you an existing rubric where you have those sections that break down those point values, all of those things. And you'll see that we still have that magic wand here and the editing option. So let's say I wanted to utilize this rubric, but I want to customize it. I want to make some changes, make it my own. Same thing applies if you were to upload your own rubric that you've got pre-existing. So a lot of elements in here to save you time and repeat work. So if you've already got something existing, being able to throw that in here and not have to reinvent the wheel for yourself every single time.
And one of the important aspects too is the editing ability because we want faculty and clinicians and educators and leaderships to still be in the driver's seat, right? So we're encouraging and leveraging the use of AI to alleviate the burden on you in creating these things like a rubric, but we still want you to have the oversight before you release it to your students or assign it to a clinical case simulation that your students will be using.
Awesome. So rubric, well, imaginary world, rubric is done. We've uploaded our rubric. We have those pieces. Let's talk about some of the other areas in here that we'd be doing for case creation. The next place I want to hop into is going to be what's called the scenario templates. Now, Andrew, when you and I were connecting on this, you equated these to what you said, I think is case specs. Is that correct?
Yes, case specs. So, as we all probably know, anyone who has authored a VR case or a case vignette or something for a screen-based simulation or an in-person simulation, you typically work with your faculty team to put together case specs that for that simulation experience. In this situation, we have developed templates for you, and you can also create your own templates. And again, these are all editable as well. So it takes away a lot of that burden again on you in creating how the flow should go for that simulation experience. So you can create your own and again, align it for how you want your clinical case simulation to unfold and the experience that you want your students to have.
So just popping in here really quick. So I opened up the create scenario template area. So looking pretty similar like the rubric where you have the ability to go in and put in these things manually if you would like to, but also we have that magic wand here. Again, if you have something pre-existing, if you've got those case specs already and you want to pop those in and have that to be the starter point that you can then again edit from here. We also have pre-existing ones to Andrew's point. So we've got a couple in here that you can use as almost like a starter framework, and then you can make additions and edits based on your needs there. I'm going to open up the nursing traditional OSCE with oral presentation because this is going to play into some of the case pieces that we're going to look at that I'm actually going to simulate. So just to show you all what that looks like, that being generated in here, you've got those descriptions, the generation instructions, and then here's all the sections that are built out for you. So again, you can edit them, open them up, look at each piece, and break down all of those things. So you can go in and make additions and edits to things if you want something to never show something, always show something. You can go in and do that in here yourself.
And one thing again, I want to emphasize, this looks daunting. It looks like a lot of information. That's why we've built in the AI editing wand so that you can use that wand, make any case adjustment you want to these specs, and it will allow you, it will show where those adjustments were made within the case specs, allow you to say you want to accept them or not accept them, and then it becomes part of your case specs and your template that you can use.
Awesome. So moving into our next piece over here, we're going to go down to the actual cases. So we've talked about generating the rubric for the grading elements against the templates of those case specs. And now we talk about creating cases. So you'll see again in here that we've got a variety of different cases that are already in here and different experiences, different situations, depending on what your need is and also what you want to actually have your students tested on. So I want to point out within the case piece is that there's going to be several different pathways that you can go through with cases. So built out of with those scenarios, whether that's you're wanting your students to do more of a Q&A, if you want them to do patient interviews, if you want them to do something like an S-bar and go back to a preceptor and give an interview that way. There's a variety of different navigation panels you can do to be able to go through those different places and use different ways. So what I'm going to do really quickly is to show you just how quickly it is to generate a case yourself. And you'll see that I was doing some practice yesterday before our call. But you'll see in here that we have the ability to generate a description and an expected diagnosis. And so if I wanted to go ahead and say that I've got a female, age 65 with chest pain, and I want my expected diagnosis to be an NMI. I here could also add in some source files. So if I want to add in some corresponding content that I've already generated, whether that's from a lecture or materials like that, I can. And then I would select my scenario template. So these are pulling into those case specs that we were talking about, or how you want that scenario to play out, the expectations, and then the tied rubrics to those pieces. So I'm going to go ahead and do this nursing traditional OSCE with oral presentation, and then I can generate my case. Now, this may take us a minute to generate. So while we're doing that, Andrew, I might have you talk a little bit about kind of just this, how helpful this can be for those as a time-saving aspect.
Yes. So again, I always emphasize that all of the individuals on this call are very well, established. You're all preeminent. You teach. You have probably faculty appointments and clinical appointments, and the time spent creating these types of materials, whether it be learning resources, study tools, clinical case simulations, can feel almost like an additional burden that you have to take on. So in this sense, you're able to generate those materials again, grounded in specific documents from your curriculum, that your learning objectives, and what you want your students to be focusing on in that point in time, whether it's a key concept or a topic, or something that you've noticed that students are struggling with, again, as you're trying to have them reach a certain competency threshold. And in this situation, we've created a case based upon what we wanted to do. It took 45 seconds to a minute. We are still putting you in the driver's seat to make the necessary edits to ensure that you believe in this case, that it aligns with your clinical objectives, your learning objectives for your students. But we're reducing that faculty time from the beginning of a case creation to the end of a case creation fairly substantially by leveraging the responsible use of AI.
Awesome. And I'm just scrolling through to just show the pieces that have been generated to for everyone. So you'll see again that we've generated a case. We have a draft now for me, and I have the pieces that I gave in and then what the um, product spit out for me for that case within the frameworks that I gave that OSCE with oral presentation and all those pieces. So you'll see here that we've got all those different areas that have been built out for us, but we can go in and edit them. So again, if this generates something that you want to make a few edits, we have the little editing icon and we also have our wand here. So if you want to make edits to something, if you want to specifically have something be presented or something in particular you're wanting to assess your students on, you can do that. Andrew and I were talking about this yesterday, how this allows some of those more specific pieces that maybe you're seeing as trends with your students that they're not grasping, or there seems to be something that maybe is presenting more in your population. You can use some of these areas and these pieces to really reinforce those at the case level, then even also at those rubrics and those scenario levels. So you can really integrate them at all those different places to make sure it's being reaffirmed in every piece. So that is just a very brief rundown of showing you all how that looks, how that works to generate a case yourself, and what that would look like on your side if you wanted to go through and do those steps. Again, we have some pre-existing almost like frameworks to start, those templates that are in here that you can use. But again, you can also start completely from scratch if you want to upload material yourself. And that's something that within the Neural Consult platform as a whole, in the onboarding process, when you're first getting, set up and geared up to use Neural Consult, that time is taken to say, let's get all of your content in here. Let's get your source material in here. Let's get the rubrics built out. Let's get all these things in here. So then once you start using it within your programs, everything is built around your environment. You're not adjusting to a different one. It's built out for you. I'm going to hop over and do a little bit of some student experience. So go in and actually take a case and show you all what that looks like. I want to give my disclaimer again for a second time that I am not a nurse. So please I know that it might be everyone's itching in there to be like, that is not the right way. So just please give me some love. And if anything, blame Andrew because he's my teacher and this is my closest access to that. So I'm going to pop over to the student side. But before I get started, Andrew, any other pieces you want to add before I
No,
get
do you
going?
want to just make a quick edit like with the wand tool so they can see how quickly an edit can be made? Maybe add in, you can add in, change, let's say change the history of present illness. So make it onset was 5 hours ago instead of 2 hours ago.
You said to 5 hours?
Yeah.
Have her generate for us while I do that. Maybe I was like, maybe my typos might be a little goofy.
So right now it's basically checking the whole case specs to see if there's anything that it needs to change, and then it should be generating in real time what aspects need to change, and then you have that oversight to either approve it. There you go. So it gave you 8 suggestions. You can either review and apply the changes, you can discard some. Um,
Just
and
scrolling
again,
to show.
yep. And again, you're in the driver's seat here. So for this instance, we can say apply selected, and now those changes are applied.
Awesome. Thanks, Andrew.
And as you notice, if you
Oh,
notice
go
there,
ahead.
just because of the screen that Jenna has pulled up, it said sudden onset 2 hours ago previously, and now it says 5 hours ago, right there under the HPI and the onset. So that's an example of she accepted the edits, and in real time the edits took place, and now you have a new case in alignment with how you wanted to change it and edit it before dissemination to your learners.
Perfect. You might have better eyes than me. I was looking for time.
Yeah.
Okay, so let's go on over here to the student side. So this is going to look a little bit different. Maybe we were living within the administrative portal, and now we're going to be living within almost like the student portal, the user portal. So there's a couple places that I'm just going to briefly point to, and then we're going to keep on going with some of the clinical cases. I talked about at the beginning of the session that there are things in here outside of clinical case creation specifically that we're focusing on today. Over here on the top left, you'll see that you've got file drive. So again, students having the ability to upload their own notes, their own study tools, or utilizing the study tools that have been uploaded by the institution specifically for them to use for studying. So whether that's lectures, textbooks, all of those kinds of pieces. And then in here, we've got a learning environment where you've got an AI empowered search notebook and then an encyclopedia in here. And again, this is where you can make specifications of where you want to pull things from. So if you want to pull things for summaries and searches or notes from particular lectures, from all your lectures, from your notes and your faculty, and then maybe some clinical guidelines that are out there, you can make all those specifications. And then lastly, in this practice area, which is where we're living today, this is where we've got a couple of different areas. Again, we've got some questions as well as some flashcards. So again, if you want to utilize content within your educational system, you can, whether that's generating questions generally to study or even board style questions specifically, flashcards with some spaced repetition and having that ability to remediate yourself. And then lastly, where we're living today, the clinical case hub. So here, you're going to see we have a variety of different cases that are available. And then these would be where your cases, if you as a faculty member, you generated cases for your students would live. But then also we've got some pre-existing ones in here that we're going to use today for example's sake. I want to call out a couple of different pieces in here. One, I'm going to be in the environment as a nursing student. So specifically the material that I'm looking at would be for me in that element. But depending on who your population is, you can make those changes, have different cases for different groups, utilizing that back end administrative side that we saw. So we're going to focus on a couple of different pieces today. Now, I'm going to be taking this case here that we have, and you'll see that two different simulation modes pop up for me. And this is a little bit of what I was talking about earlier about how you have the ability when generating cases with those scenarios and with case creation to decide what kind of dialogue or what kind of experience you want the student to have. And so I'll be doing this nursing traditional OSCE with oral presentation today. But you'll see above here that we also have this nursing traditional OSCE. So this first one up here is going to be where I'm presented a little bit of patient information. I have an interview dialogue with the patient, and then I have a little bit of a Q&A quiz at the end to be able to see what I pulled from that information and be able to recollect my experience pulling particular things. Again, this is established by you. So the Q&A that you would want to see at the end, the dialogue expectations you have, you generate that and decide what you want. The second one that we'll be doing today is going to be a traditional ski with oral presentation. So what I'll be doing is I will be interviewing a patient, being presented informations in terms of findings from labs and different pieces that we see after the patient is admitted, and then I'll have dialogue with a preceptor to give an SBAR report. Andrew, anything you want to add before I get on going?
No, the difference basically is that in the nursing traditional OSCE, the when you're presented, obviously you go through subjective, objective, then the quiz component is focused on like nursing specific priority diagnoses, nursing interventions, patient education in regard to a condition or medications, and then the nursing traditional OSCE with oral presentation, you aren't presented with that because it's more focused on being able to collect a history and then being able to give that SBAR report to your nursing preceptor, or you could say that it's the same SBAR report that you'd be giving obviously to a provider too in a critical situation. So we're trying to give those students an opportunity to practice their SBAR reports. We always know that that's something that students struggle with. They don't get enough exposure to. So that's why we've kind of have these dual pathways. So if you can either challenge them with understanding nursing interventions, priority diagnosis, education, etc., but then you can also have that secondary pathway where they focus on the SBAR report and utilizing their own voice to communicate that information to preceptors.
Thanks, Andrew. And another piece I want to point out, this is something we talked about the neural consult team recently, is being able to really customize that to have a conversation with a patient, have other information presented, go back and have additional conversations. So instead of maybe some traditional experiences that you've been limited to, this really opens the door to have more expansive and then kind of compounding experiences for students to get more familiar with, to be more real world applicable. So let's click in here. And I'm going to go through, I'm not going to do this fully to completion to where I complete everything, every single stage, because we would be here quite a bit, but I'm going to go through quite a few, answer some of the questions so you can see how the dialogue with the avatar goes, how that information is presented, and then at the end, kind of that summary of pieces that were given to, based on my experience, how I did, all of those good things. And then I'll have Andrew chime in as well at a couple different places. Oops, why doesn't it like me right now? Let's do one thing. Let me do a quick refresh. It could be me having a billion different things open. Perfect. Hi, Brianna. My name is Jenna. I'll be your nurse today. How are you feeling?
Nurse, I'm really struggling.
I'm so sorry to hear that. When did this start?
It started about 4 days ago with this sudden shaking chill, and I've just felt worse since then. The cough and the pain kept getting worse instead of better.
Gosh, I'm so sorry to hear that. Does anything make it worse?
Yeah, taking a deep breath makes it stab harder, and even walking to the bathroom makes me feel winded. Ibuprofen helps the fever a little, but not the chest pain.
Okay, what would you say your pain level is on a scale of 1 to 10?
Ah, it's around an 8 when I try to breathe in, like a knife in my ribs. It eases a tiny bit if I stay really still.
And you mentioned that you take some ibuprofen. Are you taking any other medication at this time?
Just ibuprofen and my inhaler if I really need it, but I haven't used it much.
Okay, and then what is the inhaler used for? Do you have asthma or anything else?
Yeah, It's for my asthma. Ah, it's usually mild, and I don't need it very often.
Okay, any other medical conditions that I should be aware of? Recent hospitalizations or any recent surgeries?
Ah, just the asthma. I've never been hospitalized, and I haven't had any surgeries.
Okay, and then were you around anybody that was sick? Did you go anywhere new?
I work at a nurse. Is this chest pain something I should be really worried about?
We'll go ahead and look into it and see what we can find. And I'm going to end the interaction so not everybody gets to see me interviewed for way too long. I'm pausing really quick to before we move into the next phase, but I do want to call out, I purposely wanted you all to see the dialogue with me and the patient, but you do have the ability if you needed to switch to a chat feature, to do a text-based one, and do that type of kind of interview in that style. So whether you're in an environment that you're not able to have the vocal dialogue and you want to do the chat, you can. Um, but I wanted to simulate that piece for you all while we're here. So, Andrew, did you have anything you wanted me to add before I moved into the next phase?
Yes, I just wanted to emphasize how we've established this portion to be not like point and click or anything like that. You're actually communicating with the virtual avatar because we really want to emphasize like the student's soft skill development, their ability to take an intake or an admission history, their ability to build rapport with the patient too. And as Jenna was speaking, you could see she wasn't acting scripted. She was actually asking the appropriate questions of how you would actually start to build empathy, build rapport with the patient, understand what they're coming in with, and ask them all those different admission questions that were required, whether it's in the ED, whether it's on a floor, whether they're getting transferred to a higher level of care. And we really just wanted to emphasize that when we created this, that we want the students to naturally interact with these avatars to make it as realistic of a patient encounter as possible and really hone their soft skill development.
Awesome. So I'm going to hit next phase just because it's going to bring us to our next page here. So this is going to be now moving into those clinical findings and some and case summaries. So this is where, and correct me if I'm wrong, Andrew, where we're presented with a pertinent history and some details that we have within a physical exam, and then also if we ordered some labs, some imagery, all of those pieces within here. Is that correct?
Yeah, so this is like if the provider had, so you have, standing lab orders, let's say that you've now drawn and you're presented with those lab results, or if they've ordered a x-ray, you can also customize just like any aspect of these scenarios. You can upload audio files, you can upload images, etc. So if you want your students to pay attention to adventitious lung sounds or adventitious cardiac sounds, whether it's a friction rub or a murmur or a wheeze or a crackle, you can upload those files to so that they have experiencing understanding what those sounds sound like during an assessment.
And so here we have the physical exam one, and we've got a little audio file here. And then down here, you'll see that we have a chest X-ray. We've got other details I've ordered. So this is the pieces that Andrew had just talked about. And then if we move into our next piece is going to be that second presentation. So that second interview style, but this will be me giving an oral presentation to my preceptor in the SBAR format. Anything else, Andrew, before I kick over?
No, just again, emphasizing again, all aspects of what you're seeing here, it is a case that we've already created. But again, faculty are meant to be in the driver's seat. So during the case creation process, you can edit any aspect of this. You can edit the pertinent history, the physical exam. You're in the driver's seat before you would ever be able to, before you ever would be releasing these cases to your students for their general use. So.
So, hi, Sarah. My name is Jenna. I'm a nurse in the ER. I'm going to be giving report today.
Go ahead. I'm listening.
So I'm taking care of Brianna Manigoch, age 25. She's in the ER. She presented with severe chest pain, respiratory distress, and a fever with chills. Her vitals indicate tachycardia, fever, and hypoxia. I'm pretty concerned. She's being admitted due to pneumonia symptoms, has a history of asthma, and actually is an active smoker. Currently trying to quit taking albuterol, no known allergies. Medication is the ibuprofen she's taking as well as her inhaler, and she is a full code.
Thanks, Jenna. What are your top two priorities right now to stabilize her? And at what point would you escalate to the provider for higher level support? Also, what specific changes in her breathing or oxygen needs would trigger an urgent reassessment?
Ooh, so I would say that if she has changes, if her O2 saturation goes down quite a bit, I would think that I would have to escalate that, right?
Yes, a drop in oxygen saturation is a key trigger. I'd add that increasing work of breathing, new confusion, or needing more oxygen than before should also prompt urgent escalation. If her chest pain suddenly worsens or her lung exam changes, that's another reason to reassess quickly. What early nursing actions can you start right now while you're escalating?
Right now, I guess I could put an order for IV fluids and some antibiotics.
You'll want to notify the provider and follow your scope. Start oxygen and continuous pulse oximetry. Keep her upright to ease breathing, and get IV access so fluids and antibiotics can be given once ordered. If sepsis screening or cultures are part of your protocol, make sure those steps are initiated promptly.
So I'm ending my interaction just so Andrew, if we can chime in and all that good stuff.
Yeah.
So
So Sarah, our preceptor here, was created so that she gives the students really direct, concise feedback in the moment about first off how they're giving their S-bar presentation, and then guiding them as we would if we were leading a clinical group or as we're for serving as a preceptor for a new graduate nurse or during a nurse residency program, kind of guiding them for next steps and helping them understand their critical thinking and their decision making and what should be done next in terms of how to appropriately take care of this patient and possibly, follow up again with the provider if this patient starts to decompensate. So I really just wanted to highlight that aspect of it is that Jenna purposely didn't say everything she was supposed to say because we wanted to we wanted to demonstrate to all of you who are in attendance how the preceptor kind of guides that interaction with the student nurse or the graduate nurse to lead them down that right critical thinking and decision making pathway.
yeah, this was something that Andrew and I talked about in preparation, that it's okay to be purposely wrong in these situations to really show how this is meant to guide. So I'm going to finish this here so I can show you all now. I'm going to get my score and the details that we have now. I'm going to say I did a lot better in preparation when I went through the full scenario, but I want to show all of you the case summary and then the details and then the scoring that we're given based on how I did in that interview. So you'll see that we've got a couple of the different pieces that we looked at, and now we're broken out into the different areas and how I did and the feedback for that. So if I open this patient interview, you'll see that I've got the different expectations I had for different areas as to what I was supposed to do, the scoring mechanisms behind that. And again, this is all built out based on those scenarios and rubrics that are created ahead of time to align with the case that you create. So again, to Andrew's point, these are customizable based on what you want, what you're expecting them to do, and what you want to see. So we've got some scoring pieces for both that patient interview that I did, telling me where that aligns, what I did well, what I needed to do, some bases, some areas that I could improve later, and then a corresponding score based on that data. Same for that S-bar piece. So again, if I move over to my S-bar, you'll see that I've got different pieces in here that gives me an idea. I have my transcript that I can go back and review and utilize. And then again, different areas based on expectations of what I needed to do, where I fell. And then if I wanted to open those up and see exactly what I should have been able to present and what was expected, I can do that. Um, Andrew, anything else you wanted to add on this piece?
No, I think this is going to tie very nicely into what we're going to show with where we're taking our analytics feature, because it's really important that you're going to be able to see how all this feedback can be aligned to existing competency frameworks of your choosing. So whether it's the next generation NCLEX, whether it's the AACN Essentials, Jenna will show you a little vignette that will show you how we track analytics, and not just analytics for a whole institution or a class, but down to the students too, so that you can really identify where those knowledge gaps are and use those analytics for targeted remediation and to improve your students' competence and confidence.
Yeah, so the neuroconsult team was really awesome to be able to provide us this vignette for this session to give you all a little sneak peek of some of the enhancements that are coming within the analytics side and some of that expansion area that they're working on right now. And so I'm going to play this, and I know we're getting down to the last couple minutes of the session, so I want to be respectful of time. So I'll play this and we'll talk over it while we take a look, and then I might skip through a couple of things. So exactly what Andrew was just saying and tying into what we just talked about is that they're expanding the analytics piece to be able to look at how performance is tied to actual competency frameworks. And so you'll see here that we've got a framework page here where you can put in one, whether that's manually, or again, you can use that magic wand to upload something that you already have, one that you already use, or we have some that are kind of preset there to start with, based off of some frameworks that we see utilized in the space. Andrew, anything else you want to echo on that?
Yeah, so one of the unique features here is leveraging again the responsible use of AI and not only being able to track student performance to the competency domains, but as you saw there at the very beginning when the AACN essentials were pulled up, we're actually tracking it down to the competencies and even the sub-competencies. And you have the ability to also go in and edit how it is aligned with the rubrics that you create. So it can be additive, subtractive. You can scale it to make sure that you're giving the appropriate amount of points, let's say, to each of the student actions that are expected in a scenario.
And I believe for the example's sake that the neuroconsult team, when they were created this for us, they utilized the NCLEX core competencies. And so you'll see that those are building out. That's kind of the example you're using, that you can then take that and tie that to the rubrics. And so having that ability that those things all kick back to each other, that you can use that competency map to then build the rubric and the scenarios, allows for those things to all be intertwined. Um, Also, I'm going to just skip a little bit quickly here because another piece that this is going to be, this is showing a little bit about building out cases and creating content tied to those competencies, but we want to also show from a truly analytics perspective that you can now also look at your students' performance, not only on how they're doing generally on answering questions and things like that, but also down to those competency pieces and those domains. So, Andrew, like you were saying, you can look at and isolate by those particular domain areas and see how students are doing on content that is related to that particular material. I
Very
think that
correct.
that's, yeah, okay. I was like, I think I,
Well, and then eventually we're going to also build out like an AI-driven insight so you can see how students would be doing from their first attempt to a subsequent attempt and be able to really narrow down how they where they're struggling with on that first attempt. If you assign them that case again, did they improve in relation to certain competency domains or competencies, sub-competencies, and how could we potentially build out a targeted remediation case to really focus on where each individual student is struggling with?
absolutely. So that, and again, we're pushing up on time, so I want to make sure, and if you have to hop off right at the quarter mark, please feel free to do so. We will be distributing the recording. So that is kind of the basic rundown that we wanted to give today specifically. If you are by chance attending an Axel, we will be there. So if you want to continue this conversation with my good friend Andrew, and then also another colleague and friend of ours, David, who is also a nurse, actually, they'll be there attending, that you can continue and talk about these pieces. We'll have access to this material that you can talk about live, and then ask any questions that you may have if you want to chat with Andrew and David a little bit more about it.
Absolutely. And one question, I want to take this time now to answer the
Yeah.
one question that came in the chat. Please, as I said, encourage any other questions that may come up right now. But the one question was, how is this different than me using ChatGPT or other AI platforms and uploading information into it to create a simulation? So our proprietary large language model is trained on medical and healthcare information. I think that's one of the key differentiators. It's also an institutionally secure platform. So none of the information that you input into the platform is ever shared externally or used to train the models. And your information is like, let's say you end your subscription, it's also deleted from the platform, so it's not being used by any other institution or any other user that potentially could have access to it. So I think those are some of the key differentiators between using this platform, which is specifically created for medical and healthcare education, as opposed to using some of those I would say more well-established but external, larger AI platforms such as the Chat GPTs, the Geminis, etc.
Awesome. Thank you.
We are looking into attending the NLN Education Summit this year. We haven't committed yet, but it is on our roadmap to potentially consider attending.
Awesome. Thank you. So before we wrap up, and again, if there's any other last minute questions, please feel free to pop in there. I want to talk a little bit about next steps. So again, a big thank you to attending today and listening to Andrew and I talk to you and talk about some of these key cases. Thank you for the questions. Thank you for interacting and being present. For those who are going to an AXO, please go and stop by and see Andrew and David. And for those who want to talk a little bit more about this, learn a little bit more, maybe loop in some other members of your team, do some exploration, we absolutely welcome that. So you'll be receiving a recording with this that you're welcome to distribute and share with those who may be interested in talking more about it. We can set up additional discussions with Andrew. We can look into trial access. So there's a lot of options we can look at for those who may be interested in expanding this further. Um, and in terms of me, you would come to meet me if you were to purchase something like this and onboard and do training and such. So that's where I would play into that. I did see that we had someone raise their hand. Do you want to utilize the chat functionality to throw a question in there? We'll see. I want to make sure I give a moment. And if not, again, we'll be following up with these details. So if you want to, set something up later, if you don't want to be on the spot today, that's completely fine.
Any other questions that we can answer before we let you guys go? Well, I just want to emphasize it's always wonderful to meet and participate in these and meet the esteemed colleagues and that I used to teach with and be alongside with. So thank you all for attending, and I hopefully you enjoyed the presentation and were able to learn more about Neural Consult. So thank you all.
Awesome. Yes, and if you all have any feedback when you receive this recording and anything for us, we're open to that. So please let us know. I don't see anything coming through, so I'll go ahead and wrap us up for the day. Everyone have a great rest of your day, and thanks again for your time. And Andrew, thanks again for your support.
Thank you so much. Have a great day,
Bye.
everyone. Bye.